My name is Paul Morris. I'm Director of Profession Advancement for Specsavers, and as well as helping with the CPD, I've been delivering on the main stage about our clinical outcome report and our wish to collaborate with the whole sector to make a real difference and improve the outcomes for our patients, but also for everyone that's in our sector. We're really clear that we want to share our data to make a positive impact and to help us build on the great work we did through COVID, working together as a sector to now help the population, help the NHS, help those people on ophthalmology waiting list by delivering more services within our practices, but at the same time making sure that we protect our core business, you could say, our traditional business, and make sure that those out there looking to innovate, perhaps without the same rigor and governance, don't have the opportunity to do so by educating our patients and making sure that we have real cut through in terms of why high quality eye care is so important. So the clinical outcome report is something we've developed over the last 4 years. We've got that to be available to our clinicians every month through an app called Microsoft Power BI. You can use that on your phone, a tablet, laptop, whatever it would be, and it gives them really important information about their own practice. Now, the idea is that we use that to reflect on, that we use it to form our goals for CPD, to make our development better, to offer better services to those people accessing them in our communities. Now, the really interesting thing about the outcome report is that it gives you data that you've never seen before as a clinician. For example, it can do things like show you the types of recalls that you're doing in different age bands, which hasn't been really available before. So we brought this data together to give our clinicians the best possible reflections, to give them the best possible indication of the impact they were having in their communities. And it's been overwhelmingly positive, and it's been received really well. That's a cornerstone of their development. That's something with mentorship and leadership that they can have to make sure they're the best possible clinicians they can be. And we want to upskill everyone to be part of the solution. We want to make sure that this data is used positively. It's given us some tremendous insight into behaviours, things that we can do to improve the outcomes for patients, but also to improve education, CPD, and the other things that we do in terms of the business to make it more efficient so that we can better serve the communities that rely so much upon us.
I'm Giles Edmonds, I'm an optometrist. I'm also a store partner actually in a couple of stores in the Midlands, so Sutton Coldfield and Mere Green. Been with Specsavers 14 years and Clinical Services Director. So I gave an update on the Pest Analysis, and there are lots of them. We've got an unstable political situation. COVID's had a huge impact on the health system in the UK. So we've got the economic situation at the moment. Inflation rates are at 7%, forecast to go up above 7%, over 10%. That's the challenge. We've got rising fuel prices. I think we and our patients are going to have a really tough time in terms of amount of money to spend.
Clearly, the threats have increased because the number of non-registrants now who are playing around with new technology with the defined aim of commoditizing the full scope services we provide. Obviously, particularly at this time, the public are very open to convenience, price, and that is a significant threat. And with the likes of Brillen and Mr. Specs, and there's many others on the continent, the threats are there. But the opportunities are massive as well. There's millions of people who've lost their ability to have the full eye exam, and that means hundreds of thousands of people are walking around with unrecognized eye conditions and a big risk of further loss of sight. So that is going to increase the demand, and what we have to make sure about is that we are fit for purpose to take that opportunity.
We have to have one voice. We have to be easy to deal with when the NHS come and talk to us.
As an industry, we don't yet have a single voice that represents the opportunity, and we need to be thinking in terms of the really important skills, which are lobbying, negotiating, PR, communications, and commissioning. Now, in my view, I don't see a professional organization anywhere within the industry that is talking with one voice and making that big impact that's necessary to promote change. Looking at it from the other side, NHS England, the new integrated services, they don't know exactly who to talk to ask for help, because obviously with the backlog, they're desperate to have a clear organisation that can open the doors for them.
Having worked extensively in medicine and ophthalmology, it's really clear that not everyone understands optometry, and we spoke about needing to make sure that everyone understands the benefits that we provide. I think as well with this data, it shows the care that we take, it shows the mechanisms we have to really have great clinical governance, and that will open more doors for us. And then we can make sure that we're showing that the impact we're having in our communities is helping and not adding to the problems in ophthalmology. And we can do that by sharing all that stuff on referrals, on recalls, and making sure that we've got really, really good solid data that's evidence-based to go forward and say, look, we already do all this great stuff, you can trust us to do more. And by the way, when you do so, we can show you a measurable benefit. It'll be a long road, there'll be new things that we need to do, there'll be development, but we are absolutely committed not just to developing that data, but also developing the people, the skill set within optometry and the profession as a whole to meet the challenges of modern eye care.
Over the pandemic, we've shown as a profession that we can provide incredible quality of extended services.
What I'd love to see is more of it, but also we need to be absolutely clear that those services are not a given right. They could be repealed, lots of different commissioning going on, lots of commissioning structural changes that will happen now and in the future, and we have to demonstrate the value of those services.
We don't have an exclusive right as optometrists to deliver those services. There are others that could deliver the services, so we've got to always be mindful of that. So data is important, really important.